in the group. So please feel free to do that as we go along. We will be recording it today. We may not post it on the council's YouTube channel, but it's just in case there's anything that we need to look back on. So the other thing I need to tell you is to mute yourselves when you're not speaking. And then is there anybody that needs to get away early and needs to let me know so I can bring you up on further up on the list? You got the names?
Yes, I do as well.
That's Ruth Atkins, yeah,
Thank
and
you.
Maria Quinn.
Yes, thank you.
What time do you anticipate the end of the meeting, Alison?
It depends how many people we've got. What are we up to, Mark?
We're up to 19 people at the moment.
Oh, crikey. That's brilliant.
I will need to leave by 1:30.
Okay.
Should be done by then.
Sorry, I missed that other lady's name that needed to go early.
Ruth Atkins.
No, the other one.
Maria Quinn.
Maria Quinn.
A few more coming in.
Oh, popular.
Okay.
Brilliant. Okay, so what we would normally do is give you sort of five minutes to let us know about anything you want to update on or what you do. It's a slight change today because Louise Clapton from Dorothy House has asked for a little bit longer, I think, to give a bit of a presentation. So I'm going to bring Louise up to speak first, and then I've got a couple of others that have asked to speak as well. So if we do Louise first, and then Lisa, who's from the census, Natasha from the TV licensing, and Debbie Wills from St Monica's, if you're all here. And then I'll take the people that have let me know that they need to leave early. But if we could start with Louise.
Thank you.
Thank you.
Okay, thanks. Oh, I'm Louise Clapton and I'm Community Development Officer at Dorothy House Hospice. So thank you for letting me be on the agenda, having a bit of time, because what I seek to do today is not so much a presentation, but to ask for your advice, your opinions, and sort of tap into your expertise. So I'm going to read a short statement, and it's about a whole service review that we're doing at Dorothy House. So I've just received this statement today, so I have to read it. As at the end of 2020, we embarked on an in-depth review of our services, faced with an ageing population with increasingly complex needs, rising demand for hospice care, and the impact of COVID-19. We knew that this review was timely and would help us deliver our strategic plan and care for more people. After an extensive series of listening activities with patients, families, staff, NHS colleagues, community partners, and the wider public, the first stage of the review is complete, and we have developed our vision for a new model of care. It addresses the need to widen our reach, retaining the very best of what we do, but also adapting to future need. In short, it focuses on making our care more embedded within local communities, closer to home and more accessible to all those in need. A great deal of work now lies ahead to turn this vision into a reality, and we'll be liaising with our partners and stakeholders at the earliest opportunity. And that's why I'm here, as I say, to seek your views and tap into your experience. And already some people have responded. Those that couldn't come to the meeting have emailed me with their thoughts, which is great. And I'm going to just ask some questions if that's okay. And if you would prefer to reflect and then email me afterwards, that's absolutely fine as well. But what I can say is we would really appreciate your input. It will help us develop our services, particularly in the Bath area. And particularly in the Twerton, South Down and Fox Hill area. So does that all sound quite reasonable before I start with the questions? Yeah? Okay, so the first question is, and you can speak up and say you can email me afterwards, what services does your organisation currently offer in these three areas? Is there anything that you're particularly doing? Okay. Nobody. That met with deafening silence. Okay, so as I say, if you think of anything, you can, oh, David, are you raising your hand?
Well, I'll leave it to Alison. I mean, obviously, when we come to our each individual service and our sort of 3 or 4 minutes, we'll be saying what we do. So
Fine.
I'm more than happy to do it now. On the other hand, I must leave it to Alison as to whether I say my short speech now. Could Alison advise?
Fine.
Hi, David. Sorry, it's really difficult for me because I can't actually see you all. So I can't, Mark's going to have to keep a little eye on the screen and let me know if someone's got their hand up.
That's fine.
I think if you're brief, I think it would be useful to get some feedback now and give the rest of the people here a chance to hear your views, and hopefully that will help them if they want to have a think about it. Louise, is there a deadline for when you need feedback by?
Fairly quickly, yes, I would say. I mean, before, probably by the end of the week, really, or the beginning of next week. And David, the next part of my question, the second part is, and what has worked well of the things that you've developed, the things that you've tried? Is there something that's particularly successful in these areas? And that's the next part of my question. So that sort of might narrow it down a little bit. But I'm happy to cover it later when you do your update. Joy, you're on mute, Joy.
Could you just briefly say the 3 areas again?
So it's Twerton, South Down and Fox Hill.
Thank you.
I think the only comment I'd make immediately is that I know those 3 areas. The organisation I'm representing here is Home Care Improvement, West of England Home Care Improvements. They deal primarily with owner-occupiers, not exclusively. And looking at Fox Hill, South Down and Twerton, I'm guessing that there are not that many owner-occupiers in that area.
Okay.
The only other thing is, sorry, it's a bit kind of ironic, but we also, one of the main focuses of care and repair at the moment is hospital discharge, which might not fit in exactly with your brief. I'll stop there. Okay, so, that's fine. Well, let me go through all the questions, and then if you want to go back over some, that's fine. So thinking about that particular area, and I'll say the 2 questions, do you think there's a demographic that's been well served, and do you feel there's a demographic that is underserved, that needs more work? Needs more services? Or do you think there's a demographic that's doing particularly well, they are well served, there's lots of groups for them, or that are underserved? And then there's a more specific question: what is available in these areas to those affected by life-limiting illness, associated loss and bereavement? Do you know of any services that are available, obviously apart from Dorothy House, but do you know any sort of groups, more community groups? Do you know of anything? Okay, and the other questions, well, is what do you feel is missing? What is needed in these areas? And do you find that group services attract funding, or they struggle for funding in these areas? And does it work better if I've given you the questions and then you can email me, or do you want to talk about it now, or do you want to have a think about it? What seems to work well?
I think if we see, sorry, I think perhaps if we give him a read, that might help.
Sure,
yes,
I totally get that. I like to reflect, you know, I have to think about it, but that would be great, be really helpful if you could.
Yes.
And if you, I mean, I can always send the questions out again, or if you just want me to quickly read through them again, then have a think about them. That's great.
Yeah, I'll be more than happy to answer them.
Great. That's and then the other question, the other part of it is with any of the groups, and I know there are probably a lot of virtual groups and it may not be appropriate, but do you think any of the groups that you work with would be willing to talk to me at all? And that's another thing to have a think about. It would be great if they could. I realise the time frame is really, really short, but that would be helpful, but I realise it's a bit of a stretch. That would be great. Okay.
Thanks, Louise.
Okay.
It's a really helpful introduction. I think it is, you know, quite difficult to get that feedback when it's without any questions in advance. So I think if you pop them in the chat if you haven't already.
I will do.
And I'm in the middle of doing the latest interagency bulletin, so we can put something in that or send a special one out to our mailing list to get and people get in touch with you directly as before. And I think that way.
That's great. I've had some really good responses that have come by email so far, which is great, that people couldn't be at the meeting. But it's basically, you know, what's working well, who do you feel is underserved, their needs are being met quite well, and the provision for life-limiting illness, associated loss and bereavement, more at that community level rather than more at the medical sort of level. Yeah. But I will put them in the chat.
Yeah, that's lovely, Louise. Thanks ever so much. Thank you. And now, is Lisa here? Lisa Wareham? No?
Yeah, I'm here.
Oh, you're
here.
Yeah. Oh. I can't see. It's really strange talking to someone I can't see. So, Lisa, you're from the census, so the floor is yours.
Oh, thank you. Hi, everybody. First of all, I'd like to thank Alison and Mark for letting me join your group and be part of your meeting. There have been some little articles going out on the Interagency Bulletin about census, so hopefully some of you are aware that census is happening. Census day is the 21st of March. Census engagement manager. I am working on behalf of the Office for National Statistics. So my role is to actually engage with all the communities within BANES and try and get their understanding and participation of the census.
Hi, Lisa.
So the census takes part, and the whole idea is it provides you. Hi.
Is it just me, or does Lisa keep coming in and out?
No, she does keep coming out in and out.
Hi.
I think the
Hi, everybody. Hi, Lisa.
Hi.
I think people are struggling to hear you. It is a bit sort of
Okay.
cracking out a bit.
Right.
The joys of Zoom.
Right, let's try moving. Is that any better?
Yeah, that sounds good at the moment.
Yeah?
So try again. Try again.
Right. Okay. So I will start again. So my name is Lisa. I am the Census Engagement Manager for BANES and also North Somerset. My role is to engage with communities in the area so they gain the understanding of the importance of participation within the census. Can everyone hear me now? Yeah? Yeah. So census takes place every 10 years. And the census provides a unique, detailed snapshot of our society. By taking part and encouraging others to do the same, you'll help make sure your community is counted in decisions on services and funding. The next census, like I said, is going to be on Sunday, the 21st of March. And for the first time, this will be a digital-first census. But paper questionnaires will be available for those who need it. And actually, the 10% of the population will have paper questionnaires sent to them, and that will be dependent on digital issues within the country, and they've been highlighted. But those that don't get the paper questionnaire can always request one. So we'll be focusing on engaging with everybody, including underrepresented and hard to reach for people who need support to take part online. So census information. It informs decisions that helps improve lives on planning and development, public health and social care, and also housing. So billions of pounds are allocated to local services using census-based information every year. And that goes towards education, transport, emergency services, libraries, waste collection and disposal, and all of those other sorts of public services. So why am I speaking to you guys today? Well, no one knows your community better than you. We understand that building positive relationships with communities means more people understand the benefits of the census and are likely to take part. So I need your help to raise awareness and understanding of the census in your community. 75% of the population will complete without any intervention or assistance at all. The remaining 25% is where I need your help and support. So for the low-income families, the elderly, the digitally disadvantaged, these are the areas that I really want to engage with. So with your knowledge, your awareness and your access, you can actually help me to reach these communities. We will support everyone throughout the census process. So the local community engagement staff will be on hand throughout. There will be census support centres. There are actually going to be 2 in Baines. I can't actually confirm the locations of both of them at the moment, but there will be 2. And this will enable us to help everybody participate and join in. If you've got any worries and queries about the personal information, before we publish any of the statistics, we make sure that they don't include any personal information at all. The information we collect in the census remains anonymous for 100 years. Everybody must complete the census. Legislation made the modern census a legal obligation in 1920. So the census timeline, like I said, Census Day is the 21st of March. And the way that everybody will know about it is that every household will receive a postcard. And this will be telling them that census is coming. So these postcards will be out on delivery between the 22nd of February and the 3rd of March. Then on the 1st of March, the contact centres and support centres will go live. So the contact centre is like the Census HQ, where all the telephone queries and etc. will be going through. And then the local support centres, like I said, there will be 2 in Baines. On the 3rd to the 13th of March, every household will receive a pack telling them how to join in and how to participate in the census. So within this pack, there will be a letter with a unique number on. This number or code will enable anybody to go online and to complete the census. And it will also have the telephone number on for you to phone up and request your paper questionnaire. So that will be between the 3rd and the 13th of March. Those will go out. Census Day, like I keep saying, is the 21st of March. So as soon as you have got your unique code from your letter, you can complete the questionnaire, you can complete the census, and all you are doing is completing, saying where you will be on Census Day. So you don't have to wait until the 21st of March to complete it. You can complete it prior to that. Reminder letters will start arriving for those that haven't responded. Those will start arriving from the 22nd of March onwards. And then the last day to actually complete the questionnaire online or order the paper questionnaire will be the 4th of May. So there is quite a wide time scale that you have to actually complete the census. Some of you may be wondering, what with COVID being here, if it's still going ahead. I can assure you 100% it will be going ahead. Obviously, there has been a contingency plan put in place by the census team, and that will be obviously reviewed as the weeks and months go on. They have upscaled the the amount of calls that can be taken from the support centre. So originally, I think they were expecting something like 100,000. They have now upped the capacity to 500,000, and that is to obviously accommodate those that maybe won't be going out to the census support centres and will be requiring, you know, telephone assistance. So that's one of the things that they've put in place. When it comes to the census support centres, obviously, dependent where we are with national lockdown, will obviously depend on how these support centres will be assisting the residents within the areas. We may find that, although they will be manned, they may be using local telephones systems and doing it that way. So if local residents want to talk to somebody local on the phone rather than the national helpline, that's how they'll probably end up utilising the contact centres. But like I said, contingency plans are in place. So as we go forward, that's how they will decide how to use them. Any questions, anybody?
Okay.
No.
Yes. It's David. Sorry.
Hello.
One of the other hats I wear is I'm a volunteer with Bath Welcomes Refugees. Now, this is the first time I've heard about the census, so I've no idea if our chairman knows about it. So I support 2 refugee families whose English is pretty poor. They're Arabic speaking. I certainly at the moment don't go into their homes, so there's no way I can help them. I don't really want to do it by a video call. It's a bit too complicated. You can get access to an interpreter, but that generally has to be paid for, often by Julian House. A very short question. Is there any support then for those who have real difficulty? And both my families have difficulty with English language.
Yes, so there are, although the actual questionnaire is in either English or Welsh, there are, I believe, there's booklets that I believe are in 39 different languages, and I do know Arabic is one of those, and they work alongside the questionnaire and they explain the questions. The Arabic family in question, are they online? Do they use any computers, etc.? Because there is a so they can. Most people who use different languages, they have got software on their equipment that will translate. So the census actual questionnaire will be in a format that it will translate for them into their language, and then the language booklet can be requested, which assists the completion of it.
I'm sorry, this is as a follow-up. Sorry to take up too much time.
No.
How do they get access to this if they have difficulty reading the document that comes through? I mean, a simple question, can one order some and I drop it off to the 2 families?
Yes.
You can see what I'm saying. It's okay.
Yes. Yeah. Well, is Mark or Alison able to put my email address in the chat while I carry on talking?
Yeah, if you read it out.
Yeah. So anybody who wants anything from me, please email me. I can pop some documents into the post to you. I can send some downloadable content for any of your individual websites. So yes, please, I want as much help and support from you guys. Like I said, you're the ones in the communities, and I can't get out there. So initially when I was taken on for this role, the whole idea is we were supposed to be out in the communities, meeting you guys and, you know, trying to talk to the communities. I can't do that. So I'm sort of quite reliant on you guys now. So anything that you need from me or any suggestions, any families, like you said about the Arabic family, anything like that is just great intelligence for me, really. So yeah, and any help and support that you can give me or I can give you, please just you know, get in contact with me.
Thanks, Lisa. I am getting a bit conscious of time because we've got a few people
Yeah,
want to speak before
of
1.
course.
But what if you could email me what you read out today, that would be really
Yes.
helpful, and I can
Yeah.
stick that in the interagency bulletin with a link to your email address,
Yeah,
and
that's
that will
great.
reach you more people as well. So that would be
Yeah.
lovely. Thank you so
Thank
much.
you so much.
No, that's okay. And if, obviously, Mark's just popped Lisa's email address up there, so you can get in touch direct with Lisa if you've got any further questions. Natasha, are you there? Natasha from the BBC TV licensing.
Hello, Alison. Yes, I'm here.
If you want to go
Okay.
next.
I
Okay.
will. Thank you. Are you able to, Alison, can you enable screen sharing on my, or I can just talk, whatever is easier. I've just got a message.
My colleague, my technical assistant is all over it.
Is Mark able to do that?
Can you do it?
It's just got host is disabled participant screen sharing as a message. Otherwise, I can talk off by heart.
He's looking. Start talking.
I'll start talking anyway. All right.
Yeah, he thinks you can do it now.
Yeah, that's looking positive. Of course, now I can't actually find the presentation, which is a pain. Let me just, I'll if it doesn't work, I will talk anyway. Last try. Oh, here we go. Great. Can everyone see this? Can you see the slides? Brilliant. It's literally only 3 slides. I'm not going to take up too much time. And can everyone hear me okay? Alison, if you can hear me, give me a excellent thumbs up from the group. Thank you so much. So it's just really, I just love this group. It's so eclectic and everyone covers so many different areas, and who knows where we all intersect and slot together. So I'm going very general, or actually I'm just cherry picking a few of the areas that I cover. My name's Natasha Lee, and I'm the communication specialist for TV licensing in the Southwest. I'm based in Bristol, and I cover quite a wide area. So there's just 3 things I just wanted to cover today in case they cross over into other people's responsibilities and briefs. And but my role is to help with any aspect of TV licensing. The first thing I just want to say is if anyone, if everyone can see this next slide. Yeah, so over 75s, anyone who works with older people and would like some support with the changes to the TV license for the over 75s, I'm very happy to help. I can do training, or I'm not an advisor, but I can help with clients who to talk through these changes and the support on offer, and what the processes are. Please do get in touch with me. The second thing I wanted to say, which I just jumped on the chat to mention to Karen, is there's obviously a huge increase in the number of scam fraudsters who are targeting TV licensing customers by sending them communications via email, sometimes text, rarely letter, but they're certainly closely imitating TV licensing communications. So we are working with a lot of organisations nationally and sort of locally as well, to just remind people to not respond to these communications. How to spot them is obviously key. And the first thing to do is obviously stop. Then we ask people to check, and then we want people to ask. So they might be asking us as TV licensing, call us and find out if it's genuine, or ask a friend at least to just look over your shoulder before you click on a link or make any payment. Because obviously what we know is that scammers are trying to rush people by saying, quick, you need to respond to this, you might get a refund, or you need to pay for your license. So again, I've got a whole suite of communications on that I can deliver to groups if that's useful, as a presentation, or I've got lots of booklets aimed at customers, again, just reminding them what to look out for, and how to not fall victim to a scam. Lastly, in this little thing that we're talking about, the little quick roundup of what current projects we're working on. There's a new simple payment plan that TV licensing have launched. Actually, it was launched last year, and we're just getting out the word to as many debt and charity and money advice organisations as possible. And I work with a lot of citizens advice. I work with student money advice. I work with food banks and lots of independent sort of money and debt advisors to help people get onto the simple payment plan. Now, this payment plan is aimed at people who are finding it difficult to pay, financially struggling, are possibly in arrears. And you know, at the moment, and it looks likely to stay that way for the short term, if you're watching TV whether are not correctly licensed, that does put you at risk of prosecution. So the simple payment plan is aimed at helping people who are struggling avoid that risk and get onto a payment plan that is sort of tailored for them and helps them manage their arrears. So again, that's just a quick introduction to it. If anyone works in that area and possibly working with people who aren't familiar with the TV license because they've recently maybe don't speak English as their first language, then to a lot of groups like that from different communities. I mean, this might be relevant for you, David, but we have information on our phone lines in 180 languages. I have leaflets and presentations in 26 different languages. I work a lot with the Chinese community, the Somalian community. Happy to work with anyone from all sorts of different communities. So just to round off, this is my email and details. I know that I think they're already in the bulletins that Alison sends out, but I'll send a quick reminder again to everyone that you are very welcome to get in touch about any aspect of TV licensing if it's relevant to the work that you do for older people, for younger people, for people struggling financially, for people setting up homes, whatever situation their lives are, we can help. I do one-to-one meetings or larger meetings, training days and so on, and that can be tailored to whatever your organisation works with. I work with people with special needs or with sight impairments, hearing impairments, and just letting them know about the help and support that's on offer. So that was it really. Thanks for your time. I'll just come out of this and pause the share, stop the share, and if anyone's got any questions, happy to speak now, or hopefully you've got my emails. Yeah, thanks. Obviously you can see a message from Matt. I'm happy to send those graphics through to you about yeah, lots of things to share on social media and so on about scams. Yeah, and I'll get your email and send that through. Is there any questions? Yeah.
I'm going to say thank you, Natasha. Yes, anyone got any quick questions?
I'd just like to say it would be really useful to get the graphics and images through, if that's possible. I'd probably like to email you some questions actually. So if I email you and then you can just respond, if that's okay.
100%. Shall I put my email in the chat, or did you manage to jot it down?
I managed to jot it down, but I don't know.
Brilliant. I'll put it in the chat again with my phone number. Anyone is welcome to contact me anytime, phone or email. I always follow up. Plenty of time to meet and have a chat and a follow up. So look forward to that. Thank you, everyone.
That's lovely, Natasha. And if you could send the slides to me as well, that would be really helpful. Like, I'll put another item in the bulletin, and anything else anyone wants promoted, just email me. In fact, I need Mark now to put my email address in the chat and just send things through. But thank you, Natasha, that's really, really helpful. And who have we got next? Joy Fraser, I think you said you needed to speak early. You there, Joy?
Yes, thank you.
Right.
Okay, so I live in Peasdown, St John, and I've been working with a committee of people to take over the old youth hub in the village and to turn it into a community centre. So we're now ready to go, and we have rooms available for hire. Now you might say, well, what's the point of that during the pandemic? but one-to-one support is allowed. So Bain Social Services have been doing some family support work with us, and Mentoring Plus have been doing one-to-one support work, and been very great. That's with vulnerable young people, and they have been very grateful to find accommodation that they can come in and use for that work. So if any of you want to do any one-to-one work, we do have rooms available very cheaply at £8 an hour, and you'd be very welcome to get in touch with me. So I'll pop my email address in the chat box in a moment. The whole project we will be developing as restrictions are eased, but one of the key points, well, the three aims are that we're delivering youth work for the community, and that will start as soon as the restrictions are allowed and young people are allowed to meet again. We have a youth worker who's on furlough at the moment, so we're quite keen to get that going again. The second thing is that we have facilities available for hire for groups to use. So there is a sports hall there, there's an outside sports court, we have an art room, and a large meeting room and 3 small meeting rooms, as well as a large open space, plus a cafe, a catering kitchen, which is going to be run by the Swallow charity, helping to train young adults with learning difficulties. And eventually, when it's allowed, they will also run the cafe there. So we've got big plans, and going at it gradually at this time of pandemic is a good thing for us, so that we're not trying to do too much at once. So the third point is that we really do want agencies who offer services in the community to come and use us. The cafe will be there, the 2 meeting rooms to the side of the cafe could be used for kind of counselling, surgeries, etc., etc. And we're very keen for people to get in touch with us to use that accommodation to support people in our area, who, many of them, obviously, it's a bus fare into Bath and they can't afford that. So just to let you know that we're there, and do get in touch if you think we can help you in any way. Thank you. Any questions?
No questions for Joy?
Oh, sorry, Joy, I just missed where you're based. What about was it?
We're in Peasdown St John.
Peasdown St John. Thank you so much. Yes, brilliant.
Oh, and I just had a really quick question. Is that where the library was, and is the library still there?
The library has moved from where it was in the Hive. We're calling it the Hive Community Centre. It's already operating out of the Hive now.
So the library's still there?
Yes, it's still in the village, but it has moved to us.
Oh, I see. All right.
It's former accommodation.
Yeah, no, it's a different building. It's
right.
It's next to the school. So if you know the school village, to the right hand side of that, where the youth hub was, if you live in Peasdown like me, it's where you go to vote, or some of the village goes to vote. But it's a fantastic facility, and it's great to see it have this lease of life and wider community use. So Joy, again, if you want to drop me an email with some details, and I can help promote that through the Interagency bulletin.
Thank you very much.
That's lovely. Right, who's next? Ruth Atkins, I think you wanted to speak earlier as well. Ruth? Is she there?
I've unmuted.
So there we go. Lovely, Ruth, all yours.
I will share my screen, but what I just wanted to say, so those that don't know me, I'm Ruth Atkins and I'm Head of Public Engagement and Insights for Baines, Swindon and Wiltshire CCG, Clinical Commissioning Group. And at the moment I'm doing quite a bit of work on engaging with seldom heard underrepresented groups about having the COVID-19 vaccination. David, I put a note in the chat if you're able to let me have your email address, because I picked up what you said about that particular family you're supporting. So just want to share with you on our website, and if I share my screen, and I will put the link to this in, hopefully it will start coming up. I'll put the link, can you see my screen? Yeah.
Yeah.
So I'll put the link to the website in the chat, but I wanted to share with you, we're having a one place of where information is about the vaccine across BSW. So we've got, it's updated regularly, so we have any overviews, the latest local position, and then we have lots of questions and answers. So for example, why should I have the vaccine? If I just click, it has the answer there. So we're trying to promote this. And the other one I will share is, and I'll put this in the box, the chat as well, is we've got an email if people have got queries about the vaccination, and we can't take individual cases, but we've decided to signpost people, so if they do have queries about it, then they can email this inbox, and it's being checked throughout the day. So I'll share that with you. So lots of questions and answers down there, which I'll leave you to review yourself. Then we've got examples of press releases we've issued as an organisation. Then we've got the vaccination sites, a piece on vaccine, COVID-19 vaccine fraud, which I'm sure you've seen in the media as well as I have, what's happening on that. So it's important we have information and share that with people. And we have lots of data then on our local position. So I won't go through, but it tells you the number of cases we've got. There's graphs if you want to see the graph details, etc. So I'll put the details in, but it's really just to share with you that we've got, we're signposting people to these different areas. It's all right, I'm just pausing, stop share. So yeah, we're signposting people to our website so they can see the information there and get in touch with us. And so through any of your contacts, if you have any groups you know that fit in the bracket of underrepresented, sound and heard, please just link with me, and I'll leave my email address as well, because we do need to link with these communities. And for example, then we know the BAME community that a lot of individuals had a higher incidence of having COVID-19, so it's really important that we reach these communities and the importance of them having the vaccine. So really it's just me putting out there, I'll put all the details in the chat. Anybody has any reflections or thinks, oh, I think they need to know about this group, reaching them, or I'm a good contact for this group, then please just let me know. There you go, Alison, that's my...
Lovely, thank you, Ruth. Are you happy, if I do a little article in the bulletin, are you happy for me to put a link into your email if people want to get in touch with you?
Yeah, I've written a note here to link with you, Alison.
Oh, brilliant, that's lovely, because I've already started it, and there I did have a little item on the sort of misinformation about vaccines, but if there's anything else you want me to put in, just let me know.
Yeah,
that's lovely. Has anyone got any questions for Ruth before we move on?
Yeah, I'm sorry, I saw your chat, Ruth. I don't know how to respond and send you my email address. I'm just not technically very good, so
don't worry. Alison, do you have David's email address?
Yeah, we can do that.
Share it with me.
We can get that out.
There you go, lovely, thank you. I will add some details then while you carry on with the next people. Thank you.
Yes, okay. Lovely, thank you, Ruth. Helen Beckwith, you wanted to speak.
Yeah, thanks, Alison. Nice to see you.
Okay. Yeah, thank you.
Mark's keeping incognito today. So my name's Helen Beckwith. I work with the library service, and just simply to flag up that there are a lot of libraries open in Bath and North East Somerset area. The 3 main libraries are open 10 till 4 weekdays, Monday to Friday. And we have 5 of the community libraries are still offering a service. Some of them are on reduced opening hours because they're volunteer led. So they don't always have enough volunteers to open their original hours. So these community libraries are Peasdown, which is in the Hive. Fantastic that Karen's managed to open there after a long closure. Timsbury, Radstock, Bishop Sutton and Salford are all offering a service in their communities, and they all link through to the main library service. So they're offering a click and collect. You order via our Libraries West website and it'll be delivered to those libraries and our 3 main libraries, and you can pick up from there. Anyone who can't reserve for themselves, as they have no online access, they can use our ring and reserve service, which is through Council Connect, and a helpful member of the library team will do that for them. There's just so much free content going on in libraries. You know, we're doing a lot of work to help people who are sort of suffering isolation and with low level sort of stress, you know, implications of where we're all at. I'm sat here working from home on my own. So, you know, keep an eye on our social media. There's so much going on there. If there's people with kids at home, we've got a baby bounce and rhyme online is still going. We just pick up on any national events that are going on. I've just had a look. It's members of my team that do this. I had a quick look this morning. We're flagging up National Empathy Day, which is in June. And they've just released their book list, books that can help for that. So we're on Facebook, Instagram and Twitter, and we do have a blog now. That I love the blog because I'm not a social media beast, but the blog kind of brings it all together, and I personally can find things a lot easier that way. And just, you know, having a library card which you can join online, and you can access all the online services via the online membership, but having that library membership has access to so many free materials, audiobooks, ebooks, magazines, comics and newspapers. I mean, what's not to like, really, I always think. So thank you very much.
Hi everyone, sorry, slight delay. They're still looking for David's email address on our system. Thank you, Helen. Thank you very much. Has anyone got any questions for Helen? No? Okay, and I think, is it Maria? Is that Maria Quinn? Is that how you pronounce it?
Yes, it's me. Hello. Yeah, yes, Maria.
Hi,
Thank
Maria.
you. Thank you, Alison. Yeah,
All
I mean,
yours.
yes, I'm more of a listener really, and then I can actually contribute to anything. But I manage a small development of 27 residents in Midsummer Norton called MHA Church Court. They're over, well, they're supposed to be over 55, but they're most of them are over 70. So yes, so I've picked up some interesting things about the census. And yes, I'm happy to listen to any other things that are taking place that can concern my residents. That's all. Thank you very much.
Hi Maria, thank you. That's great. And MHA, if anyone doesn't know, that's the Methodist Homes Association, isn't it?
Yes, it is the
Yeah.
Methodist Homes in Midsummer Norton. Yeah.
Lovely. Right, we're back to my list now. So we're going to go from the top now. Unless is there anybody else that needs to get away early and that wants to speak next? Shout. Okay, Carol Matthews, Future Bright. Are you there, Carol? She gone? Mark?
Carol
from Future Bright.
I think she may have stepped out.
Okay. I don't know whether we're having the odd crackly line. I don't know whether anyone else is as well. So I think there's some IT issues around, or broadband issues. David, if you would like to speak next while we continue to look for your email address.
Okay, I'll be very brief. So I'm a volunteer with West of England Care Home Improvements, and we primarily support elderly people or those with a disability. And I'll quickly run through the main thing that I've been asked to mention is the hospital discharge scheme. It's pretty obvious why in these times. So we've got extra funding to do works, and it's not means tested, up to £1,000 if a person is prevented from being discharged from hospital because of the lack of repairs. We do a whole range of other things for elderly people. We've got a grant to help people with energy works where their annual income is under 30,000. They can get a grant up to £15,000, providing the energy certificate is at level E or below. We've got a handy person scheme, which actually I have to be honest, I've used myself, which is a bit of a giveaway. If you've got any minor repairs that need doing, they're all been approved contractors. We've got an OT service. There is generally a small charge for that. And we also do major works for which we charge, and any profit that we make then goes back into the organisation to help support those that can't afford it. Then I think the only other thing I'd add in is that one of the things we do is do presentations to voluntary organisations. So I sometimes do a presentation to Age UK, to the volunteers, and I was thinking of that in the case of Louise. Yes, Louise is still there. So one thing I've done for other organisations is to do a brief presentation in more detail about the services we provide, because obviously in the case of Dorothy House, your volunteers will be in contact with elderly people. So we're happy to do even a Zoom presentation. And that's all I wanted to say.
That's great, David. And can I just ask you, you said it was for owner-occupiers. You do work
It's
for...
mainly, yes, there's a bit of detail behind that. We do some work for tenanted properties, but in the majority of cases, it's to do with owner-occupiers.
No, the hospital discharge scheme sounds very interesting, but yeah, it'd be interesting to get more information from you, and I'll pick up on your email address. Thanks.
Hi, thanks, David. I'm not sure how you've been getting our bulletins because I can't find you on the mailing list. Could you read out your email address to us, please? And Mark will type it as you speak. You need to unmute, David.
DOLLENDORFF, F for Foxtrot, F @gmail.com.
Brilliant. That's lovely. Okay, Catherine Bartram, are you there?
Yeah, she's there. Here we go.
Hello. Yes, I'm here. Hi, everyone. So just to let you know, I'm from the SEND Partnership Service. I'm the volunteer coordinator, and we are the local area's SENDIAS, which is Special Educational Needs and Disabilities Information and Support Service. Every authority has a version of us. What we do is support families who may be having struggles with their child's education, and our team understand the law and what those children are entitled to. And so we're an impartial service supporting the education provision. So one of the things I do is look after the volunteers, and at the moment they normally do lots of outreach and communicating with people and face-to-face interactions. That's all been shelved. So we are currently looking at a project where we will possibly be doing our own outreach virtual events. So this is just to sort of let you know before it gets sent out widely what those dates are, that's happening. But likewise, if you hold virtual events that you think it would be useful for us to join on, then that would be great. That would be something we definitely look to do. So I'll put our website and I'll put my email address in the contact list in the chat box. So if anyone wants any further details, they can contact me. Thank you, Alison.
Thanks, Catherine. And again, so, you know, anything you want us to promote, then we're very, very happy to do that. Okay, next on the list is Joanna Bryant. Joanna, they're still there?
Yeah, I'm still here, Alison. I'm from Stowe. Hi, I'm from Stowe Sutton Parish Council. I'm just here for observation purposes today, really. And yeah, just wanted to sort of catch up on what Helen said with regards to the library in Bishop Sutton, which is still offering a reduced service. The football fort is quite low at the moment, lower than it was through lockdown in November. But it is still offering that service there for not just residents of Bishop Sutton and Stowe, but also those slightly further afield, if that's their favoured option.
Yeah, it's a lovely library. If anyone's ever in the Chew Valley area, I recommend pop in if it's open.
Karen's still here.
And next up, we've got Karen McDonald.
Need to unmute.
I think you're on mute, Karen. Mark might be able to unmute you.
Nope, doesn't seem. She might be away from her machine. Kaylee's not here either.
Kaylee's not
She's
here.
not here next. So
Okay.
Kay Skip.
Kay Skip. We got Kay.
Hello, yes, I'm here. Hello.
Hi, Kay.
Hi.
All yours.
Thank you. So I'm the manager of the educational day service for the RNID. So we support adults who are deaf, hard of hearing or deafblind with additional needs in various areas of activities and life skills. So some of the things which have been mentioned today, where there might be more information available for us to work and support people with in their life skills sessions, for example, like the census and the TV license information, but also things which have been useful for me are things like the library still being open, because part of our life skills sessions we do support people with things like that also. I was wondering, and I will contact people independently just to get some idea really of what accessible information there is out there for deaf people with regard to these various services. Some, we get really accessible information from, and it's really easy to work with people, and others it takes a lot of support for us to support people, especially some of the people we support are also supported by other services. So they're in residential services or supported living services, so they get support in other ways. But some people we support live with their families in the community, and we do have some that English is, let alone BSL, it's not their first language either, because they are from another country, so they're also having to learn signing skills as well as British signing skills as well as the actual English language. So communication is a real issue. So it's just useful for me to if anybody does have any accessible information about different things, to pass that on, but also I will ask individuals independently. Thanks.
I can maybe help, Kay. We have a video of TV licensing that does use BSL. Yeah. And I speak. Oh well, I can speak some sign language because I learnt it. We did some sessions at work, so I can just sort of do greetings and things like that. But yeah, perhaps we can contact each other independently about the resources that I can share with you. And independent living is some of the sessions that I do with people with learning difficulties or sight impairments and hearing impairments. So
brilliant. Yeah, I've got your email address, so I'll ping you an email.
Great, thank you.
Thank you.
That's lovely. Thanks, Kay. And yeah, do make use of that chat facility to share information with each other and contact details. If everyone's finished with Kay, Sue Poole. Hi, Sue.
Thanks, I'm here. So I'm from Age UK in Baines, and it was just really to give a quick update on services. So and also it's been really interesting to listen to everyone else's input. So information and advice, they're working as normal on advice. So issues around TV license and census, they'd be able to help people with. If there's a particular need for a home visit, then that can be arranged. If it's something where it's critical that the person gets that advice or support and that it's done by a home visit, that can be done. The day clubs, which did open in September gradually and then sort of have closed temporarily again with this new lockdown, but the hope is that they will reopen gradually from February. So although it's with like greatly reduced numbers and obviously all the PPE, etc., if anyone has any older people that might be interested in joining any of the day clubs, which are Keynsham, Bath and Midsummer Norton, we are taking referrals. So, and there's also a dementia day club which is in Keynsham, so although there are waiting lists, they're not huge lists, so we'd welcome referrals through for them. Obviously at-home services have just been carrying on as normal, and in connection with our Later Life Connections project, which is about trying to reduce loneliness by connecting people up to other services, any befriending requests, which is now all telephone befriending, are coming through that Later Life Connections. So if people are still using old befriending forms, that's fine, they'll still get to us, but I will share the new referral form that we've got for the sort of wider Later Life Connections service. And I just wanted to, I don't know if anyone can help at all, but I'm not sure if there are any services out there for people who do speak other languages. So we've had occasionally, we don't get huge numbers, but occasionally we get referrals through, say, from like an older person who's Hungarian or Russian. And I'm not sure what services are out there for people where we might be able to, provide, refer people or signpost people. So if anyone's got any suggestions, that would be great. Thank you. And I'll add my email to the chat. Thank you.
Thank you. That's lovely. So it's great to see that it's catching my eye and I'll have a look at it properly, but it's great to see you interacting through the chat. So, I know when we meet physically, it's a lot easier, but this is, I'm glad you're still finding the meetings helpful. I think we've got Matt with us, Matt Rees. Are you there, Matt?
I am, yes. Yeah, hold on one second.
Oh, hi, Matt. Do you want to introduce yourself? Because I'm sure people will be really interested to hear what you're doing for the council.
Yeah, sure. So I recently started as comms and engagement at Bath North East Somerset. I'm specifically managing the comms and engagement around COVID-19 in the response to it. Many of the activities that we're doing, such as sending out a weekly e-newsletter to residents, managing the sort of materials that we're putting out on social media, meeting with people across the council, and so on. All of those actions that I'm involved in. There's lots of things today that are really interesting that people have mentioned that we can help communicate, and particularly relevant at the moment. Things like, any help we can offer with the promoting the library service to people who could clearly be suffering at the moment for many reasons, stuck at home in lockdown. So we want to sort of help communicate that to people. But yeah, I don't have much to sell or tell you at the moment. I'm just here to let you know that I'm here. Yeah, if you've got anything that you'd like to sort of communicate through us, then we can certainly try and get that out to people if it's relevant. Yeah, that's about it from me. Thank you, Alison.
Thanks, Matt. And if you're not already signed up to receive that e-newsletter for residents from the council, I'd strongly recommend it, because it does come out, I think it's on a Thursday every single week, and I certainly use it to help populate the bulletins. So do sign up for that. If
Yes.
you're not, you can get it through the council's website.
Yeah, I can send the link round to everybody.
Oh, that'd be lovely, Matt. Thank you. And last but not least is Councillor Tim Ball, who's just joined us. Are you there, Tim?
I think you'll find I'm here. Yes, I am here. Yes. I'm so sorry. That's not a problem at all. I've just come off an hour's webinar regarding the HMO policies and the upgrade of local plans. So I was a little bit shell-shocked quite so early. But yeah, I'll speak for a couple of minutes. It's going to help at all.
Yeah.
The council is doing a lot of work at the moment. We're updating the local plan. We're refreshing lots of policy issues and lots of ideas. HMO policy is one we're doing at the moment. We're looking to actually find people's ideas out and how they believe the policy should be shaped itself. So alongside that as well, we're looking to update all our environmental policies as well to ensure we are heading towards the carbon neutral policy of 2030. It's very important we actually do this at this particular stage. So those people online today, please head to the council website, look to see what the consultation is all about, have your say in what's actually happening, what's emerging throughout Bath and North East Somerset. That's pretty all I'm going to say to you today, because I'm a bit surprised being called quite so quick, but please make your comments, okay?
Thanks, Tim. Yeah, we've rattled through quite quickly in the end. I think a few people did have to leave. We were getting messages saying people were struggling with their broadband, and they were cutting out. So I think we lost a few people. But is there anybody that I've missed, or is there anything else anybody wants to say before we wrap up? No. Okay, well, thank you all so much for attending. The next meeting is on the 30th of March at 12 o'clock, and we'll set that Zoom up. And as I say, we'll promote it in the bulletin. We're really fortunate. We've got about 900 people on that mailing list, so it really is a good way of getting your information out there. So just do email me with anything that you want us to promote. And thank you again. Bye.
Thank you, Alison. It's a very useful meeting. Thank you, everyone.
Thanks very much.